What could go wrong? This could go wrong. So we've got a 52-year-old with 2 days of chest pain, increasing shortness of breath. SATs are 72 on 15 litres. Blood pressure is pending, basically.
Always use this persistent tachycardia despite analgesia or defervescence, so your fever's gone away and you're still tachycardic. That's kind of one of the ones that we've always hung our hat on. Unfortunately, it's probably not very good.
So is the needle required? And what I'm going to talk a bit about today is a little bit, maybe you could describe it as a bit of a Jedi mind trick, but maybe it's not. Maybe it's just being respectful to patients and meeting their needs.
Honestly, I think this is the first rule of emergency medicine. Actually, you need a plan. And if that plan doesn't work, you just need a new one, okay? Because there's always something that can be done, and you need to make a plan, and if that plan doesn't work, you just need to make a new one. So our incidence of critical illness, injury, and particularly arrest...
Another question. Chest compressions are contraindicated in traumatic cardiac arrest. Who thinks that's true?
So these are things that we often think about that are actually not associated with sepsis, okay? And they'll still sit in some of the criteria. Photophobia, not associated with sepsis. Neck pain, not associated with sepsis. Single febrile convulsion.
She's distressed, she's got central, sharp, horrible chest pain, bilateral craps, and she's really short of breath. SATs are a little bit concerning at 68. We're taking them at various places because we don't believe it's 68. But she's the colour of grey, so you know they're probably right.
Extra things that we might have a problem with here. What if the patient has an intellectual disability? So they're physically 16 to 18 years of age, they're the same size as a fully grown adult, but their capacity for understanding and for cognition equates to a child much, much younger, possibly early primary school, even preschool age.
Adam, can you please take airway for me? Claire, Graham, can you start CPR and start CPR now? Will, can you do the procedures for me?
Because you can't reason with this gentleman, and he's already caused harm to a member of staff. So being spat at in the eye, and I'm sure we've all had our guards have that happen, triggers the whole blood and body fluid exposure pathway, which is something that can be quite distressing, particularly...
3-year-old girl collapsed at home. She's had a generalised tonic-clonic seizure already lasting for 10 minutes. She subsequently had a respiratory arrest, and she's receiving bag valve mask ventilation. Yep. She's going to be arriving in your emergency department in 10 minutes.
Most people think that when the heart stops, this is what happens. It just all kind of dies out, nothing going on. In fact, for about 2 minutes or so after a cardiac arrest, there is still movement of blood because blood moves from high pressure to low pressure, from the left side to the right side, because there's a pressure gradient.
And this is the results. So blood was the most successful by itself. Blood with CPR to pump the blood around was second.
Because when we resuscitate, unless there are some specific things we do, we need to resuscitate what's in front of us. And the key to resuscitation, this is the secret to resuscitation,